Great, thank you. That gives us a good picture of some of the folks that you're seeing. And when we were pondering what questions to ask you, we thought it might be helpful for some members of the audience if you could share some numbers with us. So, for example, how many people do you see in a given week or a month? What's the discrepancy between your income and your costs? Those kinds of figures. So just a few of them.
Yeah, so we have we have 36 clinic locations throughout the Portland metro area. And just to give you an idea of the scope of the coalition and the patients that we see, in fiscal year 2011-12, we saw 51,000 unique patients, and there were over 250,000 patient visits to our clinics. 94% of the people that our clinics see are under 200% of the federal poverty level. 40% are people of color or other minority groups, such as LGBT or homeless populations. Our clinics logged 65,000 volunteer hours. So many of these are volunteer providers, doctors and nurses, chiropractors, pharmacists, people that are willing to volunteer their time, and it really makes a huge difference in what our clinics can do. And as far as the coalition goes as an organization, our website had over 200,000 visitors last year, and we're seeing that number go up every month. Well, our monthly numbers go up, which tells you how many people are out there looking to access healthcare. As far as funding goes, the coalition operates on a very tight budget. All of our funding, which comes from the Multnomah County, various grants and donations, all of it goes towards shared programs for our member clinics. And that includes medication assistance, subsidized language interpretation services, health information technology, emergency preparedness, and just a general voice to represent the clinics in advocacy matters. And just to give you an idea about how important outside funding is, we have recently not been able to completely fund our language interpretation services program. So this means that our clinics really have to scrape together their own funds and have volunteer interpreters to help them meet these needs. And it can make a big impact on patient care.
So Rosewood sees about 1,500 to 2,500 patients a month, depending on the amount of providers that we have at the clinic. We operate on a budget of $2.9 million. It is offset by the federal government. The offsets are for the uninsured and the OHP patients. As I said earlier, we see, excuse me, we see about 34% children, about 45% I'd say of those of our patients are on Medicaid, and then the remaining are the commercial insurance and the uninsured. So.
Well, it's Central City concern, like I mentioned earlier, throughout the whole system, we see about 5,500 unduplicated people a year. People tend to come to us multiple times during the year. I think at the primary care clinic, they're probably seeing about 75 or 80 people a day. And that's increasing. We just recently hired some new docs, and we're expanding our hours, so that number will be going up. If you look at all of the programs we have, including housing and employment and that kind of stuff, it gets up to about 13,000 people a year that we have contact with in one form or another. Our budget's about $40 million a year now across all of our services, and about 2/3 of that is through the healthcare program. So that includes all of the addiction treatment, all of the mental health, and all the primary care. And the sort of difference between the revenue and the expenses really varies by program. There are some programs that do fairly well. Our Old Town Recovery Center, which provides services to people who are severely and persistently mentally ill. And that's a population that almost all have either Medicaid, Oregon Health Plan, or Medicare, or both. And so that program does very well financially because 90% of its patients are insured. You look at the Hooper Detox Center, where it's about maybe 15% of the people coming in there have insurance, and everyone else is coming in completely uninsured. And so that program really struggles, on a very thin margin. Old Town Clinic, the primary care site, it's hovers right around breaking even. We have good months and bad months that are a little bit above or below the line, but we've gotten a pretty good mix in there of enough insured patients to cover the uninsured ones. And then we're fortunate in a way that we have so many different programs. We have over 100 revenue streams. So I'm always really impressed with our accounting department because I'm amazed that they're able to keep track of so many different sources of income and things going out. But because of that kind of diversity, we're also able to have a little bit of flexibility. And so the programs that at any given time are doing better financially, those programs are able to support the other programs that maybe aren't self-sustaining, but the services they provide are so vital to the community and to the people that we're serving that even if it's not making money or even breaking even, we have to find the ways to subsidize that to keep those programs going.
So with the NCNM community clinics, we have, like I mentioned, we have a lot of relationships with other organizations like Central City Concern. We send acupuncture students there, and they see patients as part of their addiction recovery programs. We have fourth-year medical students seeing patients at Outside In 5 days a week, and we have a clinic set up at Mount Olivet Baptist Church on North Chautauqua and North Portland, and we see patients there 3 days a week. So we have a lot of different kinds of locations. We have an association with Volunteers of America and their ENACT program for recovery and addiction recovery there as well. So we have a lot of different kinds of clinics that we're associated with. When the final numbers come in, which they have to come in because we report these in terms of our students' education, we see we have about 18,000 visits that we're conducting every year in our community-based health clinics in a variety of these locations. And none of our services are covered by third-party payers. In the state of Oregon, naturopathic physicians can be paneled and are paneled with Oregon Health Plan, but anybody on Oregon Health Plan also is required to have an association with a managed care organization. And the managed care organizations will not panel naturopathic physicians in freestanding naturopathic clinics. So we do get, Outside In does get reimbursement for some of our naturopathic care because they have medical doctors on staff. But at our clinics that we administer, Care Oregon won't work with us because we're a freestanding naturopathic clinic without medical doctors on staff. And so we don't have access to those monies. So what that means for NCNM is that NCNM is making an investment in these clinics because they're making an investment in their students' education. And so we have a budget of about $300,000 for our community clinics. We bring in about $90,000 worth of fees from patients over the course of the year. We ask everybody for a $20 visit fee. Not everybody can pay that. Not all of our clinics take in money, but we end up with about $90,000 in revenue. The rest is actually provided for by the college through students' tuition. So we're kind of subsidizing the care through the college itself because we haven't been able to get any third-party reimbursement for the care that we do.
Thank you. Genevieve, can you refresh our memory? How many clients are seen by all of the members of the coalition?
We broke it up into 51,000 unique patients for last year. And then as far as returning visits goes, it was 250,000 patient visits total.
Thank you. So it's mind-boggling for me to consider that 51,000 people in our region are not able to afford adequate health care. So I guess my question would be, what is causing this issue where so many people are falling through the cracks and are not able to access adequate health care? So could you maybe address some of the systemic issues that are causing this problem?
Well, I think it's important for us to realize that health is about more than just personal responsibility. There are all these factors that we consider outside factors, but that are they actually play a large role in an individual's health. And that could include housing, food security, stress, race or ethnicity, immigration status. All of these factors play a role in a person's health. And so, for example, if we have a patient that is overweight and has diabetes, it would be easy for us to say, oh, well, if she would just eat healthier and exercise more, then that would improve her health. But in reality, if we look holistically at this patient, maybe she is working 2 jobs and has the added stress of raising a family. She might not be able to afford healthy food, or maybe she doesn't have the time to prepare it because it does take extra preparation time. Maybe she can't afford a gym, or her neighborhood is unsafe to walk in at night when she gets off work. Maybe she is a person of color and has to deal with confronting racism every day. So all of these factors tie in and negatively affect health outcomes. So I think that can kind of a little bit explain some structural issues.
I can echo what you're saying, Genevieve. The culture of poverty is a real barrier. And, you know, what Genevieve is saying, this is generational for some of our patients. This is what they grow up with and they learn. And healthcare to them is a privilege. And we provide that privilege for our patients, and we provide it with dignity and respect for our patients. And we try to create an environment for them that shows them dignity and respect from the time that they walk in the door to the time that they leave. And I feel that we do provide a good service for our patients. We have excellent providers. We have mid-levels and medical doctors at our clinic, and they do a really great job for the community. And my front office staff, you know, they try to help advocate for the patients. I have outstation eligibility workers that do the patient benefits program and help get our patients signed up for the Oregon Health Plan through the Healthy Kids. That's for the children. The Healthy Kids is a program in Oregon that helps children that are uninsured get insured. I think the biggest barrier, though, is the culture of poverty. Transportation is another issue. A lot of our patients, they just don't have transportation to the clinic. It might be that mom that has the 2 kids. She has to take 3 buses to get to us, you know. And just the, you know, lack of knowledge that some of the clinics are out there, you know, the coalition of clinics. And we get about, I would say, over 6,000 calls a month trying to access our clinic. So there's a lot of people. And I think another thing is you know, recently with our economy, the way that it is, a lot of people have lost their insurance too. So they're looking for clinics like ours.
Yeah, we've seen quite a variety of barriers that people are facing. You know, like I was just saying, in terms of the economy, we've certainly seen a lot of people who had jobs that were really just working paycheck to paycheck. A lot of people who, you know, laborers who, you know, if they got injured on the job, didn't necessarily have, you know, any kind of insurance to back that up if you're not able to come to work. you're not able to pay the rent. Next thing you know, you're living in your car. People become homeless for a variety of reasons. And so without insurance, without money to pay for care, that's a big barrier. We see a lot of people who, because of mental illness, are having a very difficult time accessing the system. They don't necessarily feel safe sort of in large crowded places or sort of mainstream areas. We also see people with addiction issues who are just completely caught up in their addiction, and some people will say that that's a choice. Personally, I don't believe that. I've seen addiction as a disease that a lot of people end up in addiction issues because of early life traumas, and they end up self-medicating, and then that just sort of takes on a life of its own. And so we need to sort of help those people get over those barriers and get into care. In addition to the sort of culture of poverty, there's also other cultural barriers in terms of just the culture of homelessness. It's very hard on your self-esteem. It's very hard when you're homeless. You don't have a place to take a shower. You don't have clean clothes. You're carrying everything you own on your back. It's difficult to go places and ask for help. A lot of people feel very isolated in that situation, and so even if they somehow manage to get Oregon Health Plan coverage, they wouldn't necessarily feel welcome or be made to feel welcome if they walked into a traditional clinic. There are a lot of places out there that don't really want to deal with, or a lot of people who don't want to see some of the populations that we deal with. And that's, I think, one of the things that all of us safety net clinics really specialize in, is that we go out of our way to see what some people don't want to see, and you have to reach out and really make those extra efforts to create a comfortable environment and a welcoming environment, treating everyone with dignity and respect, so that they really feel like they have the right to access good care, because they do. All of us have the same rights to health care, as far as I'm concerned. It's not officially a right, but in my mind it is.
I agree.
Yeah, I agree with what everybody has said. There's, health care is expensive for an individual, and now, especially since the recession has hit, fewer employers are able to fully sponsor health plans for their employees and their families, and so people are ending up paying out of pocket for their monthly health insurance fees, and then paying for families. Everybody here, that when you go to the doctor, it's not just the monthly fee that you're paying for your plan. There's additional fees every time you walk into a doctor's office, and some people just can't afford that. They have deductibles of $1,000, $5,000, $10,000, $25,000. I mean, it's people are walking around with catastrophic health insurance that really is a barrier to them getting good, adequate care when there's an issue that they have to deal with. Whether it's chronic care or preventive care, it becomes a barrier. And for a lot of the people that I think that we see, even $25 is hard for them to come up with for a visit, because that means that maybe they don't buy the right kind of food for their kids that week, or they have to go without someplace else. I think we're also dealing with the illegal immigrant population also, people who are wanting to stay off the grid and stay, kind of unknown. They come to our clinics because they don't have to register, they don't have to declare who they are. They can come in and see us, no questions asked, like was mentioned before, and so we see a lot of those folks as well.
Yeah, I think another important part of that is all of us have sliding scales, so that we have some fee that we ask people to pay if they're able to, but if they're not able to, we're not turning people away. We will always waive fees if that's what's necessary to get people into care. And some of us operate pharmacies as well. We have a pharmacy on site, and we do the same thing there. We ask folks to make a contribution towards their medications, but it's much more important to be able to put that medication in their hands and send them out the door that day with the antibiotics they need, or with the diabetes medicine, the blood pressure medicine they need, because that's what's going to help them stay healthy. And it's much more important to provide that care than it is to collect the fees. And we all have the ways that we get grants and donations and collect funding to help cover these costs so that we can concentrate on getting the care to the people who need it.
We also do the sliding fee discount for the federal poverty level, and we do not turn patients away if they can't pay that day. We do ask that they pay $25, when they come in for their appointment, but if they can't pay that, we're not going to say, I'm sorry, we're going to have to reschedule you. We see them, and we ask that, they try to pay what they can. So nobody's turned away at Rosewood.